Very much. It was a little unclear how much time you would have, and if I counted the number of papers and the minutes, I realized I can't use 20 minutes to the first talk. So I'll combine the two talks to 12 minutes altogether, I hope. And it's going to be an update on polyethylene, and it's going to be some data around vitamin E stabilized poly and early clinical results. The mandatory disclosure, and we do actually get support from Biomed running the study. I have no personal financial interest from Biomed as such. And really the summary of what I'm going to tell you is that the first generation highly cross-linked polyethylene has some still not fully understand issues. We have a talk tomorrow as well, and I'll go more in depth what the problems are. And that the antioxidant infused technology was really first introduced by Professor Lars Lidgren here from Sweden, seems to be a forgiving and viable alternative. The improved mechanical properties of that polyethylene will potentially allow larger heads in routine total hip surgery. This is another slide from a talk tomorrow. This is each dot represents, and here is a pointer, I will guess. Within this square, you need to put your acetabular cup. This is 5 to 15 to 20 degrees of antiversion. This is 35 to 45 or 30 to 45 degrees of lateral version. That's where you should have your cup. This is how good we are at Mass General. And if all these patients out here receive metal and metal, we are in trouble. So, do we really need the hard and hard bearings in today's hip technology? And the forgiving one is the metal on polyethylene. Why forgiving? Because it's been documented since several decades, and it's versatile, design-wise, position-wise, and fixation-wise. The background for poly is gamma or ethylene oxide sterilized non-cross-linked poly, which was associated to high frequency at midterm radiographic osteolysis and subsequent clinical failure and revision. And this is then how the polyethylene was improved. You irradiate them to cross-link them to give more wear resistance. And then you can either go that route or that route. You can melt them. This is what Longevity XLPE Duracell Prolong is doing. Machine your components and gas sterilize them. And you see the red dots here, the free radicals, which is the problem in polyethylene, they disappear. Or you can go alternative, what Crossfire and X3 have done. I don't think they did that because they really wanted to, but there's so much IP protecting, patent protecting, so they need to do that. So they do this, machine the components, and gamma sterilize them, and actually have free radicals left in the material. So a brief summary, where are we on the melted polyethylene with 22 and 32 millimeter heads, and we had 286 patients for a minimum of 6 years follow-up, and average age of surgery is 61.6 years. This is the outcome not measured by RSA, but measured by Martell, which typically shows up in a data scatter like this. And we can really see no inclination in the curve, indicating we can't detect wear using the Martell. But more importantly, there's no osteolysis on any patient on plain X-rays. We have a large head series as well, which is mostly 36 millimeter heads, close to 100 total hips, and same average age, around 63 years. Still very good outcome measured by traditional score systems, and with Martell, what I just showed you, we see the same scatter, no detectable wear, and no osteolysis. There has been published 2 studies, one from Smallsrich, 5-year follow-up on Marathon, and he couldn't identify any cases of lysis in 32 hips with irradiated and melted. And Cloishi and Maloney, a paper that is coming out now, presented still as a podium, but they had 7.2-year follow-up in a comparative study of highly cross-linked and conventional using CT as evaluation, and young mean age, 45 years, very active patients. They had 24% osteolysis in the conventional. There was one case that maybe had osteolysis in the longevity group, more or less confirming what we are finding. Then the trouble started up when Johan presented his results here. RSA studies, randomized, as you should do, one cemented cup, one uncemented cup study. 32 patients in the uncemented, simultaneous bilateral total hip, and 25 were evaluated at 7 years. In the cemented study, 30 patients in each group as well, and Duracell or conventional poly, supine RSA, and the result was a 0.13 millimeter proximal penetration at 7 years in longevity compared to conventional 0.45, which is fine. That's what we would expect. That's how highly cross-linked should perform. But the disturbing issue, and this is a scan image for the recent OIS meeting, that they did see a shift between 5 and 7 years, increased head penetration, presumably where? And the same in the cemented study. So significant lower cross-linked were at 7 in both study group, but an acceleration of total penetration between 5 and 7, and still no adverse clinical events as such in the cross-linked groups. But this triggered us really to look closer into what happens in the poly. What can cause this unexpected wear head penetration? So we looked at 47 explants in the lab. You can see here 34 longevity, 3 Duracell, 1 Marathon, 3 XLPE, melted, as I told you first, and then 3 X3 and 3 Crossfire, annealed. They have been in the patient between half a month and 84 months, and then we put them, after some initial measurements, on the shell in air, and they were stored between 8 and 77 months. And what did we find? We did find that these polyethylene cups were oxidated, which we thought would never happen. And furthermore, that there was a very strong correlation between storage ex vivo and increased oxidation. And exactly the same was the case for D-cross-linking. So that strong chemical bond that we thought was resistant to anything in the world was not resistant when it was out of the patient and stored in air for some time. What happens in vivo that could change the stability of these components? And there's only 2 really potential factors that could do this. It's polyethylene is a lipid. It will absorb lipids from the joint fluid, from the body fluid surrounding it. And number 2, it's exposed to cyclic load. So concerns over the Swedish RSA findings, longer follow-up, more retrieved liner needed. I will go further in depth tomorrow on the poly changes. And there's concerns about the mechanical properties of remelted highly cross-linked. That's one of the trade-off you're doing. Melting it is it's become weaker. Can we improve it further was the question there. And that's how the X3, with the improved oxidative stability and annealed came up, and FDA cleared, used X3, and the other alternative is, you remember the red dots. If you block the red dots with an antioxidant, then it won't oxidize the material. And you can do that by somehow getting vitamin E into the material. And both these 2 have higher crystallinity, higher strength, high wear resistance, and very high oxidation resistance. This is what you're doing. You are irradiating as you've been doing before, and then you deep fry them basically in vitamin E and get vitamin E in, and that blocks all the red dots, all the free radicals, and then you have a very stable material. This is how it looks, the deep fryer. Machine, radiation cross-linking, immerse the parts in vitamin E, homogenize the vitamin E profile in the material, and then you can gamma sterilize, because that further improves the mechanical strength of the component, and it doesn't induce any free radicals. This is an avocado, and the content in that vitamin E-wise is the same as you got in 1 Astabler cup. This is the vitamin E profile, the concentration through up to 7 millimeters of depth. It's pretty even. It's slightly brownish, as you can see, but not oily to touch. If you do the conventional hip wear studies, you can see in clean environment, 28 conventional, 28 vitamin E, the blue ones, and the red bars with third body presence. It's much better than conventional and highly wear resistant, as good as the first generation remelted. And the same goes for X3, basically. You get exactly the same wear reduction by sequential annealing. The fatigue crack propagation resistance, which is the measure of the mechanical strength, conventional unaged is high, but when it gets aged, oxidated, it goes down. Second generation vitamin E dope, irradiated, doesn't matter if you age it. You age it by boiling it in pure oxygen for 5 days. That's really tough and maybe unrealistic aging procedure. And this is the first generation melted longevity. So you can see we have improved the strength, but we're still not as high as up there. If you do what we call environmental stress cracking, where you sequentially load the aged implants, nothing happens to vitamin E. You don't get any oxidation we can measure, at least. But if you do the same with X3 or sequentially irradiated annealed material, it actually fractures. So you can induce oxidation in it, and oxidation decreases the bending fatigue stress. Aged X3 versus normal X3 is up here, aged conventional versus normal conventional, but aged vitamin E and vitamin E, there's really no difference. And we have done a clinical study on this, close to 50 patients now. We have 37 hips in 34 patients with follow-up. And that was wrong, that slide. Sorry for that. We have 11 now, 2 years out. And this is how you do the RSA. All Swedes knows this by heart. But for the rest, you put in tantalum markers here. Then you can measure how the cup is moving. You put tantalum markers into the polyethylene. Use the center of the head, and you can read how the poly deforms alternative wears. And you do the same for the stem here to have control of all factors as such. And you put all that into a software package developed here in Sweden, and you get results like this out. This is the total superior penetration of the head into the poly. This is 10 micron, 20 micron, 30 micron, 40 micron. Up to 2 years, the total penetration is less than 40 microns, which is less than we have seen before. We should expect less deformation of the material because there's a higher crystallinity. And this is the rate, the speed with which the head is moving in, initially high, deformation up to 40 micron, and then decreasing with increasing follow-up. Of course, these are preliminary results, but it looks as longevity, it looks as no unexpected events will happen. It's a new cup we have been using here as well, a trabecular titanium metal, and the cup is very stable as well, not that important, that message. We have one surgeon that don't believe in upsizing his implants, and he's paying a price. We can identify all his patients because they migrate more, but they get stable, fortunately, at 2 years. And based on this, and based on the algorithm of a phased introduction new implant, we have then got Biomed to support a 10-year study where we basically have a study design, 10 years follow-up radiographic clinical outcome of this technology compared to Arcam, 500 patients in each arm. And there's a number of Swedish centers participating in this study. It's too early. I don't have any study results to present. But the early femoral head penetration with the new bearing material are excellent. The small amount of penetration is likely due to creep. We need more follow-up, of course. There's a lot of vitamin E and antioxidant happening. Most of the major companies are working with that technology and follow the literature to see where we are. It could be the answer, polyethylene-wise, to the new bearings. So in summary, conclusion, the first generation highly cross-linked poly have some, still not fully understand issues. The antioxidant-infused technology seems to be a forgiving, viable alternative, and the improved mechanical properties will potentially allow larger heads in routine total hip, as well as more advanced knee designs to be used with this poly. Thank you.